And I'll go ahead and call the September 22nd, 2020 Wythe County Board of Supervisors meeting to order. Okay, I'll go ahead and note that we do have a quorum with all supervisors present. We do have Mr. Vaught and Mr. Smith attending tonight's meeting via Zoom, and I will read the notice for that. Okay, in accordance with our electronic meeting policy, Mr. Vaught and Mr. Smith contacted the county administrator hear my echo, to notify us that they would be unable to attend the September 22nd, 2020 board meeting because Mr. Vaught is not feeling well and Mr. Smith is self-quarantined. Mr. Vaught and Mr. Smith participating from home via Zoom. There is a quorum present in our normal meeting room this evening, and we have made arrangements for Mr. Vaught and Mr. Smith to participate remotely through the use of Zoom, which can be heard by all persons in our normal meeting room. Approval is automatic unless someone wishes to move to disapprove the electronic participation. Okay. If not, we will move on. We have Reverend Robert Button from Wythe Presbyterian Church. If everyone will please stand while he provides our invocation and remain standing for the Pledge of Allegiance.
If I may, a point of personal privilege. I've been living among you here in Wytheville for 15 months, and it's been my distinct pleasure to have enjoyed this community those 15 months. And I only regret that my time is coming to an end. Wytheville Presbyterian has called a new pastor, and I commend him to you as a man who will serve this community well. I've made some good friends here during my time, both in the church and out in the community. I move on, taking the warmth and the beauty of this little slice of God's creation with me, and I thank God for bringing me here to Wytheville. Let's pray. Eternal God, we give you thanks for the community in which we live. You've called us to be your people and blessed us with a land flowing with milk and honey. Sometimes, Lord, we forget that our call is to be a servant people as we lead this community. We get so embroiled in rules and regulations, we forget the fundamental issues of community building, love, peace, and hope. We all too often allow our personal implicit biases to surface in our deliberations to the detriment of the public good. Forgive us when this happens and teach us to recognize our biases so we can learn how to alter and change them. Lord, you have called this board aside from the mundane things of life to consider issues that really matter to their constituents. Give them the wisdom of Solomon, the insight of Joseph, the persistence of Moses as they lead the people. Let all debate be civil, all decisions just, all resulting actions benefit to the whole community. Remind us all that you, O Lord, have raised up civil authorities for the betterment of the community, and that we as citizens must continually seek to follow those whom you have placed in authority, even while at times we disagree. Teach us to disagree with each other without painting ourselves into the corners of bitterness and resentment. And now, Almighty God, bless the transactions of this meeting, for we know that ultimately your will shall be done and your kingdom shall prevail. We pray in your name. Amen.
Amen.
Pledge
Allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you. Thank you, Mr. Button, and best wishes to you on your next adventure. Okay, next on the agenda we have citizens' time. See, we do have one person signed up. Looks like Junior Eversole. Okay. You can go and step up and speak. Just let us know what your name is and your address, please.
Do what?
Let us know your name and your address.
I'm a Junior Eversole, live in Austinville, 619 uh, that's all, I guess.
Okay.
And, I was wanting to say this, today, a lot of people is, over there, Austinville, Ivanhoe, Bethany, and wherever. And it's, I didn't bring the list that I had, and I forgot it. And, but they, interested in or concerned about this watershed over where all the pumpkins is, the bottomleys, and, it's a watershed, for a mile or so each way down to the creek. Okay, the one creek, comes down to the bottomley. It comes down to there and it joins the other creek, Beesaw, Cripple Creek. Well, it's going right into your intakes over at the pump house, you know, and people is concerned. I sprayed, you can plant this rye and kill it out in one day with the spray that they use. Okay, the other thing, you know, they've been spraying, since spring, Coy knows that, and, they spraying today, and all, which they probably spraying nitrogen today, don't matter. But, anyway, the people is concerned that it's going right into y'all's intakes, over at the pump house, and, I got to say, I checked it for myself, and other people have been asking me about it. A creek goes through my place, Cripple Creek. Not Cripple Creek, Mill Creek. But anyway, there's, used to be abundance of minnows and stuff in there. And, there's no minnows whatsoever in that creek, either creek. And when I worked for Gulf and Western New Jersey Zinc, Austinville, before I went to the state, we at Austinville, we had to put minnows in, a confined thing, and if there was some minnows dead, we had to report it. And then the people come out, But that's what I'm, trying to say. I'm here for the people, and I was elected to come, which that's my first time here. I don't know nothing about it, but that's what the problem is. And I've got some numbers that they give me. I went over to the water plant too, and I called and Mr. Barrett and all, and he put me to the water plant over here, Austinville. And but main concern that I was saying for the people, they worried about this water, all this toxic stuff going into the creek, then going into y'all's intakes, then pumping it up on top of the hill. But that's, other than that, that's about all I got to say, other than there's no fish or minnows or anything in that creek. I've been there, and I, checked it for the last 3 or 4 years, and other people has too. And that's about all I got to say. If y'all would look into it and whatever.
Okay. Thank you for coming to speak to us about that. That's definitely something to be concerned about. Mr. Bear, is that something we're already looking into?
Yes, Mr. Zach at the New River Regional Water Authority has been aware of it. He's looked into it. Our staff has also contacted the Virginia Department of Agricultural and Consumer Services to let them know of citizens' complaints as well. We have a representative from the Health Department here as well, and she can take the information back and refer to them from the Department of Health, the drinking water and all that. But yes, we have been made aware of it, and we have reached out to the agencies to make certain that it has been addressed.
Okay, thank you. Okay, that's all that we had signed up for citizens' time. Is there anyone else that would like to speak? If not, we'll close citizens' time.
Madam Chairman, Gary Ogle is here tonight.
Okay,
He probably wants to speak to you, you just can't hear very good.
okay.
Mr. Ogle, you want to come up front and talk to the board? You want to come up here to the front and ask the board about your request?
Well, I can't hear her, by the way.
I understand. Come up front here for a minute. So if you would state your name and address and then ask the board what you want.
Okay. My name's Gary Ogle, and what'd you say the address?
Yes, sir.
And I live at Castleton Road, and I'm here to ask you about some veterans. Why does a veterans have to pay the water fee board?
Okay, Mr. Ogle, what exactly is your concern?
She asked what your request is. What are you asking the board to do?
Well, I'm trying to get it where I'm a veteran and I don't have to pay it.
You're talking about the monthly fee?
Yeah. Yeah, the water bill.
Okay. Mr. Ogle pays a non-user, minimum monthly fee, or what we used to call a non-user fee for water.
Okay, Mr. Ogle, thank you for your service, and I believe the best thing to do is to refer that to the Water Committee.
She said, thank you for your service in the military, and they're going to refer that to a committee to review that.
Okay, are you done with me?
Yes, sir.
All right, I can leave?
Yes, sir.
Thank you.
Thank
Thank
you.
Thank you, sir.
Thank you, sir.
Thank you, Scott.
Okay, would anyone else like to speak during citizens' time? If not, we will close citizens' time. The next thing on the agenda is a public hearing for the proposed revision to the comprehensive plan. Let me get there. I will read the notice at this time. Let's see. Okay, the Wythe County Board of Supervisors will conduct a public hearing on Tuesday, September 22nd, 2020, beginning at 6 p.m. or soon thereafter, to consider a recommendation to revise the transportation section of the Wythe County Comprehensive Plan. The hearing will be conducted in the boardroom of Wythe County Administration Building, 340 South 6th Street, Wytheville, Virginia. Any person may appear to state their views thereon. The proposed recommendation can be viewed at the Administration Building. The hearing is held in compliance with Section 15.2-2229 of the Code of Virginia. By the order of the Wythe County Board of Supervisors, Stephen D. Bear, County Administration. Mr. Bear, would you like to summarize?
Yep, what you have in front of you, Mr. Kinser, that's here with us, the county engineer, has been working with VDOT over the last year probably on a couple of projects for smart scale. One of those being a revised intersection at Apache Run, which Wythe County is submitting for smart scale consideration. And the other is for an I-77 truck climbing lane on Interstate 77, basically from Red Hollow Road up to Interstate 81. And that one has been submitted by Mount Rogers Planning District. The smart scale application process requests that it show that these projects are within the county's capital or comprehensive plan. The Planning Commission held a hearing at their last meeting and have recommended the addition of this addendum that you see to the comprehensive plan. And the public hearing tonight is to get comments for you all to consider adding this to the comprehensive plan also.
Okay, thank you, Mr. Bear. Let's see, I don't have anyone signed up to speak regarding the public hearing. Is there anyone in the audience that would like to speak at this time? Okay, if not, we will close the comment section. Mr. Bear, do we need to take action on this?
I would request that the board take action to approve this addendum to the comprehensive plan.
I'll make that motion.
Okay, got a motion, do we have a second?
Second.
Okay, just so, well, first I should say, do you all have any discussion or comments? Okay, just so you all know, I'm going to start all the votes with Mr. Vaught this evening, and then go to Mr. Smith, and then around this direction, so it doesn't get confusing. Okay. If no discussions or comments, we'll do a roll call vote. Mr. Vaught? Aye. Mr. Smith? Aye. Aye.
Aye.
So approved. Okay, next item on the agenda is payment of invoices.
Make a motion to pay the bills.
Have a motion. Do we have a second?
Second.
Okay, we have a motion and a second. Any questions or discussions? Any invoicing board member would like to pull out and review? Okay, if not, we'll do a roll call vote. Mr. Vaught? Aye. Mr. Smith? Aye. Aye.
Aye. Aye.
Okay, so approved. Mr. Vaught, Mr. Smith, can you all hear us okay? Yes. I see him nodding. Okay. Okay. Next item on the agenda is, let's see, the minutes of the previous meeting, which was September 8th, 2020.
I'll make a motion to approve.
Okay, we have a motion, a second? Okay, any question or discussion? No, if not, we'll do a roll call vote. Mr. Vaught? Mr. Smith? Aye. Aye.
Aye.
Okay, minutes are approved. Moving on to old business. The first item under old business is refinancing agreements. Mr. Bear, would you like to summarize that for us?
Yes, what you have in front of you is the refinancing that we talked about at the last meeting. These are the bond documents. You have a bond purchase agreement that is in there for reference. But on page 79 of your package, you have the resolution authorizing the issuance and sale of the general obligation bonds of Wythe County in a principal amount not to exceed $28 million. I would request that the board take action to approve this resolution.
Okay, do I have a motion to approve this resolution?
So moved.
A second?
Second.
Okay, we have a motion and a second. Any discussion or questions regarding that? Okay. If not, we'll do a roll call vote. Mr. Vaught? Aye.
Aye.
Okay, approved. Next, under old business, we have infectious disease prevention plan, revision 1. Mr. Bear?
Yes, Madam Chairman, we have a couple of additions to that. We have basically just a couple highlighted areas of adding the public information officer in under the lower exposure risk and putting the treasurer's office in at the medium risk. And that are the only revisions to that, and recommend you all approve the revisions to this plan.
Okay. Do we have a motion to approve the revisions to the plan?
So moved.
Okay, a second?
Second.
Okay, do y'all have any questions or comments, concerns? Okay, if not, we'll do a roll call vote. Mr. Vaught? Aye.
Aye.
Okay, so approved. Mr. Bear, do we have anything else under old business that we need to add?
I do not know of any additional items under old business. Thank you.
Okay, if not, we'll move on to reports. Okay, first under reports, we have Virginia Department of Health, Dr. Karen Shelton. If you'd like to step up, thank you. Good
evening.
afternoon.
Hello, good afternoon. Yes, thank you for having me this afternoon. Mr. Bear and I were discussing, we wanted to do an update on COVID-19 for Wythe County, kind of how it's affected us and where we go from here. So there's a slide presentation we'll get up here in a second. As you know, COVID-19 has been an epidemic that has spread globally, and so it has affected us in Wythe County. I have to say that Wythe County has, I shouldn't even say it out loud, done relatively well with this throughout compared to some of the surrounding counties. We'll go over a few of those details, and we will, look at some things there. As we look at the state map, you can see that COVID-19 is all over the state, and some areas have been harder hit than others. For the whole state, we have 142,000 plus cases right now, with over 10,000 hospitalizations and unfortunately over 3,000 deaths. For the state, that equates to approximately 7.5% of those who are diagnosed will end up in the hospital, and approximately 2.1% of those who are diagnosed will unfortunately die from the disease. For Wythe County, for the Mount Rogers Health District, which I represent, of 8 counties that extend from Bristol, Washington, Smith, Wythe, Bland, Grayson, Carroll, and Galax, we have approximately 8.6% hospitalization rate across the district, and approximately 3.7% death rate. For Wythe County specifically, we run approximately 8.9% hospitalization rate and a 1.7% death rate, so that's relatively better. To date, we have 223 cases for Wythe County, with 20 hospitalizations and 4 deaths. Next slide, please. As we look at the state as a whole, we look at how active the disease is across the state. The Southwest Virginia, far southwest, which includes from Wythe County down to the tip of Lee, has been in a widely sustained transmission for the last approximately 8 weeks, and just this week has gotten to go down into the moderate sustained transmission, which means we had a lot of cases going on, and it's gotten a little bit better in the last week. Next slide, please. As we look at, this is a slide that's done by the Ballad Health System that looks at the 21 county Ballad footprint, which Wythe County is technically included within. A large majority of this is within Tennessee. It's very interesting to look at the cases over time and how they've played out. Southwest Virginia was relatively spared in the early days of the pandemic when we got our stay-at-home orders. And then you can see Tennessee opened toward the beginning of May, and Virginia opened toward the middle, on June 10th. You can see the increase of cases that became in Southwest Virginia and Upper East Tennessee starting about mid-June and really beginning to peak up into July and throughout August and into September. You can also see the relatively high number of cases from Tennessee, which are in the orange, and fewer cases in Virginia. As the cases in Tennessee began to spike, you will see that Tennessee, the local counties, Tennessee never went under a mask mandate for the state, but local counties within Northeast Tennessee that were spiking put mask mandates into place, and you could see that after that they did begin to come down a bit. Again, Virginia never got quite as high of spikes as they did, although we continue with cases in Southwest Virginia. We feel that a lot of these cases that were fueled by Tennessee, and specifically within our district, Bristol, Washington, and Smith have been very hard hit over the last 2 months. We feel that the effects in Tennessee have pushed up into those. I think Wythe has been relatively spared because you're about an hour away from the Tennessee line, and so it may have had some sparing effect for Wythe County regarding that. We also know that summer travel has fueled a lot of these cases, and as we do our case interviews of every single case that is diagnosed, we find that summer travel to various hot spots has been a factor. Next slide, please. If we look at the Mount Rogers Health District as a whole, we have had cases throughout the district since the beginning. We had particularly large surges of cases throughout May and June in the Galax and Twin County area, especially Carroll County and into Grayson. And as I said, starting at the end of about the middle of July, we really started spiking cases in Bristol, Washington, and Smith. Next slide, please. Wythe and Smith fairly paralleled very early on as far as the relative number of cases, but Smith County really took off at the middle of July and has almost double the cases that Wythe County has right now. So like I said, Wythe County has been relatively spared compared to its very close neighbors. In Wythe County specifically, we started early on across the whole district with travelers, people who had been to hot spots in various places domestically and internationally. We then had some community transmission. We had a few businesses affected. We had some healthcare workers affected. When we started having more spikes in Galax and Grayson in the middle of May and into June, we had healthcare workers that worked in those areas that were residents of Wythe County that affected us. In the last 2 months, we have had relatively more cases in Wythe County. Next slide, please. And you'll see that these are weekly case counts since the beginning that we've seen. And so over the last, really since toward the end of July, you can see Wythe County has had an increase of cases, again, although relatively less than most of the rest of the Mount Rogers Health District. Some of these specific cases, we have found no real specific trends. You have been very thankfully relatively spared as far as long-term care facility outbreaks. Most all surrounding counties have outbreaks in their nursing homes and assisted living. This really pushes up the case counts. What happens is when you have a lot of cases in the community, as much as we try to protect our long-term care facilities, we will find that people become infected. And it usually starts with the workers who are out in the community and then gets into the long-term care facility. Because this can spread silently, it will get throughout the long-term care facility. And unfortunately, we do have a lot of deaths associated with outbreaks in nursing homes and assisted living facilities. Again, you have been relatively spared, thankfully, in Wythe County with that. A lot of your neighboring counties have had outbreaks in their long-term care facilities. That has fueled some of the cases in Wythe County because you have people who live in your county who work in these other counties in their long-term care facilities. Those then get brought back into the home, into the children, and that sort of a thing. As far as other recent trends, specifically for Wythe County, we've had a few larger families to get it. Some of the highest risk factors for getting COVID-19 will be those within your household. Once someone gets affected, those within the household are at highest risk of also getting COVID-19. We also find that people who share a ride in a car together are at very high risk, and also people who eat meals together are at very high risk. So we have, there's definite guidance for businesses regarding best practice as far as your workplace, how you can decrease the risk of COVID-19 within your workplace. Some of the other things that we've noticed as far as cases, so travelers, households, healthcare workers, other workers in other businesses, those seem to have been the main things within our community here. Next slide, please. So as we look at specific other metrics within the community, the first one relates to our case incidence, which is an average moving over 7 days and as a rate has generally been decreasing in Wythe County over the last 2 weeks, which is great. We also see that our testing positivity has reduced. Generally speaking, if your cases are going up, your testing positivity goes up. And a lot of people lynch a lot of things on the testing positivity. It's a factor, it's not the main factor. We know that if you have a positivity rate of what the positivity rate means is the number of positive tests relative to all the tests that you've done. So when you have a lot of positive tests, 25%, that means you're probably missing some of the cases in the community. And when you have a very low positivity rate, that means you have a lot of tests and not many people are testing positive. So it relatively correlates with your cases. So that's also dropped down as well. You can see the outbreaks. We haven't had any recent, knock on wood, thank you, Lord, for outbreaks in Wythe County recently. And then healthcare workers, like I said, have been factors on and off throughout. That is something specifically measured. They don't measure other types of occupations like they do for healthcare workers. Really, the whole goal of everything that we've done through the health department, as we talked about before, we investigate every positive case. We try to see who they've had closest contact with. Those are the people who are at highest risk of getting COVID-19. And we put them in quarantine so that they don't then become sick and spread it around in the community. Our whole goal has been to slow the progression of this disease. You know, when we first started out, we thought we could contain it, we could stop it, it would go away. But as it became a global pandemic, we realized that that wasn't going to be. So by slowing the disease, we have been able to maintain our healthcare capacity. Our hospitals have enough hospital beds, both for those with COVID and those who do not have COVID but who need hospital care. Heart attacks, other illnesses, emergency surgeries, all those things. Our hospitals have maintained capacity. We also have have been able to get more PPE or protective equipment, both for our first responders as well as our healthcare workers, so they can safely take care of those in our community who they may or may not know if they have COVID-19. We've also been, over the course of time, been able to get more effective treatments for COVID-19. When this first started, there really wasn't anything out there. So they now have antiviral medications and other protocols that for the very sickest of those who have to go to the hospital, they can use these medications. And we've also been able to get closer to the vaccine. We're awaiting the day when we can provide vaccine to the community. We want to wait until it is safe and effective, and when that time comes, then we will provide you more information about that. Next slide, please. So we look at testing availability, the Virginia Department of Health website. You can put in your zip code and it'll tell you places around you that you can test. We recommend anyone who is symptomatic to be tested, anyone who is a contact to a case to be tested, and anyone who's concerned that they may be contact to a case to be tested. We do have testing at the health department, but there are other places in Wythe County and surrounding areas you can be tested. Next slide, please. We test at the Wythe County Health Department on Mondays, Tuesdays, and Fridays. First thing in the morning. We ask that you call for an appointment just because we like to get all the information over the phone. It's a drive-up test. You literally drive up, you get your swab, you go. We do them across the street in the parking lot over there where we have room for people to come through. That way there's no paper handling or anything like that at the time of the test. Slide, please. There is an app that you can get for your phone called COVID-Wise. A lot of people are concerned that it's a tracking device, but it's really not. It's based on what's called Bluetooth. It doesn't even activate until the person with the app turns positive. They put in a PIN number, and then that sends out a signal to anyone who was within 6 feet of them for more than 15 minutes, could possibly be a close contact. Then that alerts you that you may have had contact to a case. In more rural communities, it's a little harder to know how well this app will be effective. We certainly encourage people to try it. I know in more urban settings, and I know it like at colleges, it's a great tool for people as they're around and about on campus to be able to use. Next slide, please. There are resources for businesses on the Virginia Department of Health website as well as on the CDC websites. If you have any questions about best business practice, how you can protect your staff and your coworkers from COVID-19. Next slide, please. We have found that one thing I failed to mention was we have had some outbreaks in churches. One of the neighboring counties had a large outbreak in a church. We've had some cases within churches within Wythe County. We just recommend best practice for all of our religious gatherings. We encourage people to continue with their religious gatherings. I do feel that faith is very important to help us during these difficult times and always. And so we do encourage people to continue with their church gatherings. We just want them to do it very smartly, wearing face masks and an inside closed-in place, staying 6 feet apart outside of your family. So families sit together, but then others sit 6 feet apart, washing hands, and then, of course, cleaning the areas, and staying home when sick. Please, if you're coughing and you're ill, don't go to church or anywhere else in the community for that matter. We do encourage people to stay home when they're sick. Next slide. So these are just the things that we recommend for the community. We didn't have on your packet, I don't think we had a slide for this one, but on your packet there is a little graph just to mention regarding this is a modeling or a prediction of possibly how COVID-19 might go. It's done for every county location. And what this provides is kind of a scenario of what can happen within the county and when we're predicted to peak. Originally, Southwest Virginia was predicted to peak in the kind of late September timeframe. Now it's looking like it may be into October, but it's very individual. You can see on the graph that there are 3 different lines, the dark blue, the light blue, and the yellow. And those have to do with really community response. How responsive is the community to the best things that we can do to prevent the spread of disease? The best things that we can do to prevent the spread of disease are wearing your face mask, especially indoors, staying 6 feet apart as best as possible, washing your hands a lot, hand sanitizer everywhere, and of course cleaning and disinfecting, particularly indoor surfaces, and then again, as I mentioned, staying home when you're sick. If you're ill, please stay home. We encourage that. Based on this, grid, best scenario is when we do all the things to help protect our community. The second scenario and the third scenario have to do with if people gather a lot and don't do social mitigating factors. We do, of course, have, and all of our counties have had discussion, including Wythe County, with our schools about what it will look like when school comes back into session. One of the things we mentioned is that we've had relatively fewer children in Wythe County thus far to be affected, only 20 cases of school-age children ages 5 to 18 since June the 1st, and only 4 of them since the middle of August. So we know that when schools come back into session, there will be cases, and we will help work with the school system to help to manage those cases. We will assist them with case investigation and contact tracing. Of my 8 localities, 4 currently have in-person and hybrid virtual models, and 4 are still completely virtual. I think many of them are planning to go back toward the end of October. Thus far within the schools, we have been relatively pleased and surprised with how well things have gone in the schools where, and we do recommend that when you go to school with full mitigation. Face masks, that's for every student and every teacher from kindergarten through 12th grade. That is the best way to prevent the spread of COVID inside. Staying as far apart as possible, hopefully 6 feet. Not all classrooms can contain that. Making sure that things are cleaned and disinfected regularly, helping the children and having the children help with the cleaning schedules around their own desk spaces. Making sure we are good examples with hand washing and hand sanitizer, and of course encouraging parents to keep the children home when they're sick. That is the most effective way that we can help the spread of disease. So we'll be working with the school closely with the school system when they are ready to go back regarding these things. In the schools where the face masks have been worn, we really haven't had to quarantine whole classes or even whole buses of children because they've been doing everything they could to prevent the spread of disease. In the schools where they're not wearing face masks, we sometimes take out at least half of a class, if not a whole class, in quarantine because no one has been doing social mitigation. So it makes a difference how well the schools and how long the schools can function. So if we have further surges within our community, it may look very different. In Wythe County, like I said, we've been very blessed thus far. There has, unfortunately, there's a lot of morbidity and mortality associated with the disease that we don't always hear about. We do know that those who are older, of all the 90 fatalities within the Mount Rogers Health District, all but 12 have been over the age of 70. So we do know that the elderly are most affected. And probably 80% of people will have a mild disease or no symptoms at all, and about 20% will have a little bit more of a difficult time with this. So does anyone have any questions for me about COVID-19 in general or anything specific for Wythe County or surrounding counties?
Could you elaborate on that 4th death? One of them was somebody that actually lived here in the county or a resident that was out of the county?
I can't give you any specifics about the deaths, but only residents of Wythe County are attributable to the Wythe County site. So it doesn't matter where it doesn't matter like what hospital they went to. If that was a factor, it only matters where they live. So deaths are only assigned by the county of residence. Mm-hmm.
I have a question regarding the rapid test.
Mm-hmm.
Does the health department feel they're reliable, fairly reliable? I guess one of my questions that I'm looking at is obviously with the current testing, obviously it takes several days, and whether it's schools, whether it's county, whether it's essential people, I know some localities looking at using their CARES money to get rapid tests and have them at the hospital so that if I'm sick, I can go get a rapid test and I don't have to be out of work for a week waiting for a result. Are they accurate enough to do things like that?
So the rapid tests are very helpful. There are different ones out there. So some may be more reliable than others. I know that the ones that most people in my district are using are very reliable when it comes to the positives. A positive is a positive. They're almost 100% corollary with the PCRs. Where they sometimes fall short is with the negatives. So there's about 1 out of 5 who would truly be positive that test negative. So if they have symptoms, sometimes you still have to be a little bit cautious about that. But as far as finding out if you're positive, it is a very good test. And I would encourage Wythe County to do whatever it can to bring more rapid tests into the community. We have looked at trying to get rapid tests at the health department, but we couldn't get any machines. We've checked with the vendors and they're not in supply right now. So other hospitals or other avenues may have more success in procuring those machines. I know that the long-term care facilities, they had a state agreement and the state was able to provide many of our long-term care facilities with these rapid tests to facilitate. They have to test 1 to 2 times per week right now, all their employees. So rapid testing is a good thing, and especially once the schools go back, it would really benefit Wythe County to have rapid testing capability. The contact tracing and the case investigation in schools gets pretty, lots of spider webbing. It's like it gets pretty extensive in the schools. So having the capability to know for sure if a sick person has COVID or not is very helpful. Yes.
Thank you.
Any other questions for Dr. Shelton?
Dr. Sept, Brian Ball here.
Yes.
And I'm going to bring up, I guess, since the beginning of this, and it's the point that we can't get accurate information. I've talked to my counterparts from other counties, and they're as frustrated as I am. The public wants accurate information, and I think part of that is to tell them how many active cases we have, not just how many cumulative cases we have. When you were speaking, you said that part of the health department's job was to make sure that we have enough hospital beds. I'm not sure how you can do that if you're not keeping track of the active cases.
Yes, sir. So active cases as being tracked has been a big source of contention amongst many of the counties. We have talked with the emergency coordinators, and I think you provide active cases on your website, don't you?
Mr. Crawford does do an update every day, taking the information and pulling out
Yes.
active cases.
So we have ways to track the active cases. Unfortunately, the Virginia Department of Health at the central level in Richmond did not choose to include active cases on their dashboard. We have asked them about that a lot and told them that our communities really want it, but we have not got that information provided on the dashboard. We do have ways of calculating active cases, and we do communicate regularly with Mr. Crawford regarding cases in the county, and those cases are relayed to you regarding the number of active cases. We do the same for all the other counties surrounding as far as our communications.
Thank you.
Yes.
Okay. Any more questions for Dr. Shelton? No, if not, thank you so much for the update, and I can thank you personally for everything that the health department's doing for the families and the individuals that do have COVID. Liz Green is wonderful. She has got to be the world's sweetest person to call someone when they're sick and just to talk to her. But not only her, others as well. I just don't remember their names. But thank you. I know it's been a heck of a year.
It's been very, very busy, very difficult, but we have a great team here in Wythe County, and Liz Green she's our charge epi nurse, and she does lead the team on that. So I'll give her the kudos and let her know. But yes, thank you for that. And if there's any other questions, please feel free to ask me.
Thank you so
Thank
much.
you.
Have a great evening.
Thank you.
Okay, next we have the treasurer, Lori Gwynn.
I don't think my presentation is going to be nearly as interesting as Dr. Shelton's was, but we'll try. Okay, I have a lot of things for you tonight. I'll start with the financial report, and then I'll move into what's currently happening in the treasurer's office update. So in your board packet, you have the August financial statement. And you will notice that for the month end of August 31st, in the general fund, or excuse me, in the consolidated account, told you I couldn't follow it up. Dr. Shelton's throwing me off. The cash balance was $60,570,806, and of that, the general fund balance contained, can't get my fingers working, I apologize, $35,954,817. Of course, every month we kind of fluctuate. We're sort of on the downhill slide a little bit with taxes. So in the coming months, you will start seeing our numbers upticking as far as overall cash on hand and and revenue coming in. But does anyone have any questions on the financial report?
I don't
On the
believe so.
revenues? Okay. So, moving on, it's tax time. So, Commissioner of Revenue Kathy Vault and I have been working to get everything processed for the tax bills. Mrs. Vault's pretty much finished her end, turned everything over to us. I've been working very hard, and the office staff as well, trying to get bills out. I've been working for about a week to resolve an error on personal property that I cannot resolve. I recruited help from Munis. The ideas that the gentleman had to assist me were the same ideas that I had already had. They didn't work for me. We tried them for him, and they still didn't work. So I'm kind of held up right now. I contacted Munis support yesterday morning as of leaving the office and running out the door at about 10 till 6. I still had not heard a response. So until I can get that resolved, I'm sort of in limbo as far as being able to get our tax bills finished processing to get those to the printers, because once they actually go to the printers, it's a good 2, if not 3 weeks before the bills are back in the county, and I had hoped to already have our files out and bills be back in to all of us at least by the middle of October. I'm still hoping that that time frame will be accurate, but depends on how quickly we can get this resolved, because I can't move on with everything else, because if I do, this error can continue to mess everything up. So I don't want to have to reverse everything that I've done and have to do it a second time if at all possible. So staying on the taxes, for real estate, we will be sending out a total of 19,861 bills that will be totaling $12,640,000. So included with that, or in addition to that, excuse me, are the Grouse Ridge projects, District A and B. So those are billing out at almost $26,000. Before our tax bills go out, we apply the what we call the agent income credits that the county currently provides to taxpayers, and that's up to a $200 tax credit on real estate, or it can be on personal property if they have a mobile home that is their residence. Also includes disabled veterans credits as far as a full credit and partial credit. So we take into account all those adjustments in billing out. So personal property, we will be sending out a total of 28,277 bills. So if you're keeping count, that's over 48,000 bills that will be mailed out in the coming weeks. Wow. Postal Service loves us. The total billing on personal property is at almost $10,100,000, and also age credits and some disabled veterans credits do apply to personal property bills as well. So we're looking forward to moving ahead, being able to basically get everything started and start having the folks coming in and getting those paid. We're already getting calls wanting to know how much they owe, when they're due, things of that nature. We do have all the information on the system. We just are not to the point of being able to bill out. Later in the meeting, you will address under new business the 2020 personal property tax relief rate, just a prelim note leading into that. From the Commonwealth of Virginia each year, we receive a little over $1.5 million to apply to our vehicles within certain value range, and that's outlined in your resolution. If there's questions later, I'll be glad to address that then. Any questions on the billing of real estate and personal property or anything like that? I'm kind of throwing a lot of numbers at you that everybody's glassing over. So, okay. One other thing that I've been working on with the help of our added IT staff, Todd and Melissa were great to help out with that. Melissa probably got stuck with it more than Todd did, I think. But dog tags. Each year our number decreases on the number of dog tags that we sell, and that is people that are coming in buying the county tags for their dogs after they receive a valid rabies vaccination from the vet's office. The veterinarian's offices are required to submit a copy of those rabies certifications to our office. We are supposed to send notification to the dog owners within a certain amount of time if they have not obtained a dog tag. I have an employee in the office that worked under Mr. Crockett, and she's been in the office about 17, 18 years now, and she said she's never known them to send these out. So it's been a very long time since the office has done this. So in COVID times when we were closed down, things going on, but not a whole lot of action going on with various things. Worked with Melissa Kegley. She pulled our dog tag file from our old system, which hopefully we can get rid of eventually. But last week we mailed out 3,400 delinquent letters to dog owners in Wythe County, notifying them that either their dog tag had expired or it was due to expire in the coming months, and outlining for them portions of our ordinance, the cost for those dog tags and things like that. So I did notify Arlen Dunford that we were doing this so that he wouldn't panic on me. Spoke with him yesterday, and he's well aware that they have been mailed. I looked for them to be back in the county today. It's probably going to be tomorrow before they're back. So if you have questions from any of your constituents, certainly send them to our office. We'll be glad to address their questions for them. But we're going to start tracking those differently to assist Mr. Dunford as well, but also help us that on a rolling monthly basis we can send renewals out or reminders out that we're not doing a mass mailing of 3,400. We had got it pared down to 4,900, did a little bit more tweaking to it, and was able to get it down to 3,400. So that's and the number of dogs was over 5,000. So that's a lot of revenue that's hanging out there that we need to pursue, but also it helps protect us as citizens and other people, just ensuring that folks do have their dogs vaccinated and are purchasing everything that they should. So, but have them to call us if they have any questions. We'll be glad to address any concerns there. Any questions related to the dog tag mailer that I can possibly answer?
Y'all be ready for your phones to ring a lot tomorrow. I'm just playing.
It's just a farm dog. He stays at the barn. Okay, I think that is all that I have. No, one other thing. Let me go back to taxes. I'm missing Mr. Vault tonight. He usually gives me that kind of side frown
He's
there,
doing it.
so I can't look at him to see if I'm getting the same look tonight. It's been a while since I've updated you on our collection numbers for 2019. Hadn't done that for about 2 months now. We've upticked a little bit since then. Overall, we're a little over 97%. So we're not making great strides at this point, but 97 is a whole lot closer to 100% than other numbers are. So overall, it's gone well. The Grouse Ridge tax collections for 2019 have been rather slow. I don't know that the taxpayers fully understand that they're being taxed for this, even though some prelim work has occurred there. I'm not sure that it's all tying together as far as seeing progress on the road that they feel like they should pay that tax bill. So that's a little slow, but other than that, 2019 numbers are looking really well, and excited to get started on 2020.
Ms. Gwen, if you will give a report of the paid and unpaid on the Grouse Ridge Road.
Okay.
If you'll send that to me, I want to have Mr. Kinser and Ms. Castle put together an annual report on that just to see where we are.
Okay.
Thank
Be
you.
glad to. Be glad to. Okay. Anyone have anything?
Any questions for Ms. Gwen?
Mr. Vault?
Thank you, Ms. Gwen.
Thank you all.
Thank you.
Thank you. Okay, next thing on the agenda is the Building and Grounds Committee report.
Building and Grounds Committee met on September 15th, 2020, and made the following recommendations. entering into a contract with Lane Group for architectural space planning services for the Wythe County Office Building Addition for a lump sum fee of $11,200.
Okay. Mr. Bear, do you have anything to add to that? Or
No, that's
someone
just,
else?
that's just the design work to make the space, revise the space for our treasurer and commissioner to review.
Okay, coming from committee, we do not need a second. Any questions or concerns? If not, we'll do a roll call vote. Mr. Vaught?
Aye.
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 Okay, so approved.
The Building and Grounds Committee met on September 15, 2020, and made the following recommendation. Entering into contract with Claire Asher to provide architectural and engineering services for the development of the Barron Springs Community Center for a fee of $9,800.
Okay, anything to add to that, Mr. Bear?
No, ma'am.
Okay. Coming from committee, it does not need a second. Any discussion or questions? Okay, if not, we'll do a roll call vote. Mr. Vaught? Aye.
Aye.
Okay, so approved. Thank you, Mr. Cook. Next item on the agenda is the Water Committee report.
All right, the Water Committee met on September, shit's got to go. The Water Committee met on September the 15th, 2020, and recommends the following. Approving change order number 2 for the Ricky Road Water Extension Project.
Madam Chairman, I will add, this is a change order, an increase of $11,880. Most of it is dealing with the tie-in for the additional labor and material price increase, basically due to some hurricane factors in the Gulf Coast area, increasing price factors. Our staff did review all these and confirmed their recommendation to approve this change order.
Okay, thank you, Mr. Bear. Coming from committee, it doesn't need a second. Any questions or concerns? If not, we'll do another roll call vote. Mr. Vaught? Aye.
Aye.
Okay, so approved.
Second would be approving the master service agreement for the Fort Chiswell Max Meadows Sanitary Sewer Evaluation Project.
Okay. Coming from committee, it doesn't need a second. Any questions or concerns? If not, we'll do a roll call vote. Mr. Vaught? Aye.
Aye.
So approved.
And third is approving the following accounts be written off and closed. Do I need to read all these names?
Just
Just
say the list, it's right there, it's presented.
The list of 4 that's presented.
Okay, coming from committee, once again, it does not need a second. Any questions or concerns? Okay, if not, we'll do a roll call vote. Mr. Vaught? Aye.
Aye.
Okay, so approved. Next item on the agenda is the Wythe County Regional Library update. Miss Mary Thomas. Good evening, how are you?
Doing pretty good.
Good.
I'm Mary Thomas, Director of the Wythe Grayson Regional Library, and I want to thank you for the opportunity to update you on what our library system has been going through. In May, our children's programmers were switching gears from transitioning from summer programming to virtual programming and trying to figure out how to stay connected with households with and without. Does anyone mind if I remove my mask?
That's fine.
Go right ahead. It's your pleasure.
Our children's programs were switching gears from traditional summer reading programs to virtual programs and trying to figure out how to stay connected with households with and without internet connections. They did a great job of presenting a variety of online options, live and recorded. They also came up with weekly activity bags that could be picked up at the library. They strive to have enough bags for every child who wanted one in every family. Not surprising, this became very popular as the word got out and the summer progressed. In May and June, the system ordered more ebooks that had a method for obtaining electronic cards to check out the materials from Overdrive, which is our ebook and e-audio book platform, or through the Libby app, which is done through Overdrive. We had staff who were able to answer questions on how to access electronic reading materials on our database through the phone system. On the week of June 15th, the Wythe County Library started curbside service 4 days a week. This was as touchless a service as we could possibly arrange. Understand, we are very much a face-to-face and cordial with our patrons as possible, and talking 6 to 12 feet away for some of our patrons was just not a feasible option. But we did as best we could to maintain that social distancing. Our staff were wearing masks and tried to keep everyone as protected as possible. Rural Retreat followed about 2 weeks later, offering curbside service 2 days a week. Staff have been available to answer the phone, help with book recommendations, help place holds, help set appointment times for picking up library materials, and for anything else that the public called the library for. Directions to get to someplace. We get a variety of different kinds of reference questions and directional questions, and the staff were there and available on the phones to help as needed. As demand increased, the Wythe County Library has expanded its service hours and days. Staff are available 9 to 6, Monday through Friday, to help with electronic resources, answer reference questions, and set up library cards, and they're doing this all through the phone. We have a thriving D&D group. This is teen-led and library facilitated as an online program. Do you all know what D&D is? Dungeons and Dragons. We had a thriving group before COVID. The teens really enjoyed it and missed it. We've set up an online service with rules and regulations, and we've vetted them out with the parents of anyone who is under 16 years old, and it has been a thriving group. We have anywhere from 4 teens attending up to 16. The week of September 7th, we started our business center. We have public access computers available for use by appointment only. Other services available are printing, copying, and faxing. The faxing is taken care of at the front door on an as-needed basis. We are currently working with the Wythe County School System to get library cards to all students who do not currently have a card. This is to gain access to our ebooks, our databases, and the Library of Virginia databases that are available through our website. When the library closed in mid-March, our benchmark for opening the library back up to the public was 14 days with no new cases. That seems like an impossible hurdle at this point. Our new benchmark is testing to be at least 5% positive rate or less, according to the Virginia Department of Health for our area. And I found her presentation very enlightening. I just checked a few moments ago, and the number continues to go down. It was at 7.9% rate for all testing, and I believe it was 5.5 for the PCT testing. Our current goal is to open the Wythe County Library for limited services on or before October 15th, earlier if at all possible. According to the calculations, our building can handle 30 people in it, and as long as we are not running programs, which we cannot run face-to-face, that should be almost a normal service day for us without programming. Do you all have any questions about our opening, or?
Do you have any questions for Ms. Thomas? Okay. Well, thank you so much for coming and giving us that update, and I certainly hope you are able to open up soon.
We miss our patrons as much as they miss us.
Absolutely, I'm sure.
Thank you.
Thank you so much. Okay, next item on the, I'm sorry.
Chair, I'd like to interrupt you. Before we go on to CARES Act review, can we go ahead and go down to new business and do the PPTR rate? And so Ms. Gwen can go back to trying to get 40,000 tickets out.
Absolutely. We'll go ahead and move down to the new business section, 2020 PPTRA, which is the personal property tax relief rate.
She has presented it earlier. Basically, they do a calculation every year, and the rate is continually going down. Basically, it was 70%, I think, was the initial rate, and now that it's flat funded, we divide that out among qualifying vehicles. Not too much of a drop. We were at 36.95% this last year. This year calculates out to 36.08%. On page 263 of your agenda is Resolution 2020-31 to establish that rate as all vehicles under $1,000 get 100% tax relief. Between $1,001 and $20,000 will be eligible for 36.08 tax relief, and registered vehicles above 20,001 or more will be eligible for the 36.08 tax relief on the first 20,000 of that. So I recommend the board adopt the resolution 2020-31.
I would make that motion.
Second.
Okay, we have a motion and a second. Any questions or comments? Okay, if not, we'll do a roll call vote. Mr. Vaught?
Aye.
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 Okay, so approved. Thank you. Thank you, Ms. Gwynn. Okay, we'll move back to the CARES Act review. Mr. Bear, would you like to summarize that for us?
Yeah, several items here. My apologies to colleague. Turn back on here. Several items of action here. The first group is 5 items that you see there. The CARES Committee met and they recommended the following: the funding for the Wythe County Community Hospital, the Wythe County Sheriff's Office drone, the Wythe County Regional Library furniture, the Wythe County Regional Library hand sanitizer and supplies, and the Regional Library virtual programming and telecommunications. If there's any question about any one of them, could go individually. If not, I would recommend a motion and a second to approve those 5 items for our CARES Act funding.
I'll make that motion.
Okay, we have a motion. Do we have a second?
I'll second that.
Okay, a motion and a second. Any questions or comments?
Mr. Barrett, I'm not sure if Mr. Farthing is in attendance, but I know there's like 5 requests, but since one of them does deal with the sheriff's office, do I need to abstain or?
He's getting his mic.
Yes, Brian, I think so. I think you should abstain from the sheriff's line item there.
Okay, are we doing them all as a group?
How about we back up on that motion, if you all don't mind, and pull the sheriff's office drone out of that motion?
That's fine. Yeah.
Okay, Mr. Vaught, did you hear we're going to vote for 4 of them, but not the sheriff's office?
Who seconded that motion?
I made
And
it.
you're fine with the second of
Yes, sir.
withdrawing that? Okay.
Yes, sir.
All right.
And then we'll vote on the sheriff's office drone next. Okay, so we had the motion, we had the second. Did that raise any more concerns or comments? Okay, if not, we'll do a roll call vote. Mr. Vaught?
Aye.
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 Okay, so approved. Next, do we have a motion to approve the CARES Act request for the Wythe County Sheriff's Office drone?
So moved.
Second.
Okay, we have a motion and a second. Any questions or comments? Okay, if not, we'll do a roll call vote. Mr. Vaught?
I'll abstain.
Abstain.
Aye.
Okay, so approved.
The
Do
next
we-
is Big Walker Dentistry. Original request had come in for $100,000. The committee had a few questions, and the individuals actually understood from their request and from dealing with another locality, they needed to make a revision. They went back, they have made a revision, and they would request $43,000. as shown on page 190 of your package. This did remove all of the lost revenue items that they had in there.
Okay. Do we have a motion to approve the $43,000 to Big Walker Dentistry, the CARES Act? Okay, I believe if we do not have a motion, would
And if
anyone?
y'all would like additional information before that, I'll be glad to go back to them and talk to them about that as well. Be glad to do that.
Okay.
There
Do y'all
was a
have
question
any-
that was raised about this being the Bland Ministry Center. The Big Walker Dental Center is actually over here in Wytheville, and this is services for what they provide here. The Bland Ministry Center did request funding from Bland County for their operations over there, and I understood they got, I believe she said in the meeting, and Brian or Mr. Cook make it for them, I think they said they got $40,000 from Bland County for their Bland Ministry Center over there.
Okay. Does anyone else, or does anyone have any questions for Mr. Bear right now, or would you all like to review this further and put it on next week's agenda? I'm sorry, the next agenda?
I'll make you should improve it, just so we can get it out there and discuss it.
I'm sorry,
I'm
Mr.
sorry,
Ball,
what-
would you repeat that?
I said I'll make a motion to approve it so we can get it on the floor to discuss it.
Okay, we have a motion. Do we need a second, Mr. Farthing, to have the discussion? Okay. Would anyone like to second so that we can have the discussion?
Second.
Okay, we have a motion and a second. Would you all like to discuss this further at this time?
I missed this in my packet, I'd like just a couple.
Absolutely. Take your time.
Reading it, if that's all right.
Absolutely.
While Mr. Cook reading, I will say that they made a presentation for the CARES Act Fund Committee, and they do see a lot of patients from Wythe County. They are taking, I guess, extreme measures with the PPE because, I guess, of the hazards of working inside somebody's mouth with the virus that's spread through saliva droplets. So I think there is a definite need for what they're requesting.
Mr. Bell, did they allude with what the percentage is of Wythe County residents versus non-resident Wythe County residents?
They did, Mr. Smith. I don't remember the exact number. Mr. Barrett might.
I don't remember the number.
Okay. Does anyone need additional time to read through that? Or do you have any further questions, comments, concerns? Okay. If not, we'll do a roll call vote. Mr. Vaught?
Aye.
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 Okay, so approved.
The second part of their request is $737.88 to support the food pantry. Very good to support the food pantry. It's a relatively small amount of money in the process of what they're requesting there. Leave it up to you all.
Okay, thank you, Mr. Bear. Okay. Do we have a motion to approve their request for the, the amount was
$737.88.
So
Okay.
moved.
Okay, we have a motion. Do we have a second? Okay, we have a motion and a second. Any discussions or comments regarding that? Okay, if not, we'll do a roll call vote. Mr. Vaught?
Aye.
Aye.
Yeah.
Okay, so approved.
Now, these others are on the package. These have come in. We're not on the agenda at that point in time, so we'll take those. The first one on page 192 of your package, with County Parks and Recreation, Kevin Williams has found some outdoor hand sanitizing stations to go around the various places. I recommend approval of the request of the $35,2920.
I'll make that motion.
Okay, we have a motion. Do we have a second?
Second.
Okay, we have a motion and a second. Any questions or comments? Okay, if not, we'll do a roll call vote. Mr. Vaught? Aye.
Yeah.
Okay, so approved.
The next is for the recreation and sports equipment hand sanitizer. Recommend approval of that one also.
Make that motion.
Okay, we have a motion. Do we have a second? Okay, we have a motion and a second. Any questions or concerns, comments? Okay, if not, we'll do a roll call vote. Mr. Vaught? Aye.
Aye.
So approved.
Next, as COVID, and Dr. Shelton helped give me some supporting argument of this one earlier. One of the goals is keeping individuals out in separate vehicles as much as possible. And with our water department, Mr. Crisp is working hard to keep everyone separated, but there are a couple of, we do have more individuals than vehicles, and there is a request for $29,588 to buy another vehicle. And Mr. Crisp, I think it's a compact, is it Chevy Colorado or Ford Ranger? Chevy Colorado, is that correct? Chevy Colorado.
Okay.
Make that motion.
Okay, we have a motion. Do we have a
Second.
second? Okay, we have a motion and a second. Any questions or comments? If not, we'll do a roll call vote. Mr. Vaught? Aye.
Aye.
Okay, so approved.
The next is from Mr. Bowers. This is a request for a compact track loader. One of the items that we've had a few things this year, Mr. Crawford has had some shipments come in of large amounts of supplies that we do not have any type of equipment for unloading in the county, and we have had to use outside sources to do that. Mr. Bowers is with us, but he has talked about several requests for do those, and you see a request from him for $63,607.81 for the purchase of the compact track loader.
Make that motion.
Okay, we have a motion. Do we have a second?
Second.
A motion and a second. Any questions or comments?
Madam Chair,
Yes.
the only question I have is, if we can justify the 84-inch bucket, based on the request.
Mr. Bear?
I will let Mr. Bowers come forward and speak his recommendation why he was including the bucket to go with it.
Mr. Chair, I had requested the bucket along with the forks for the different types of medias that we get for unloading. So we've unloaded everything from pallets to loose media to 55-gallon drums of hand sanitizer. And I was just trying to make sure I covered most of the bases for what we were going to need to be able to move the materials around with.
Thank you. I didn't realize you were getting shipments of loose media. Thank you, Mr. Bowers.
You're welcome.
Thank you, Mr. Bowers. Okay, any other questions or comments?
I have one. Has this got a backup camera on it? I'm serious, because I've got a skid steer, and I mean, you can run over something easily.
I did not check that option off. No, I'd say it does not.
I think that's something you need. just for safety aspect. So do we need to add that to it?
Do you have any
or-
idea what the additional cost is on that?
I would not have an idea what it would be.
If you all will approve for this request with the addition of the backup, that'll be fine. And we'll update the quote to show that.
Okay, so we need to change the motion.
I would just do a motion to approve the purchase of the compact track loader.
With the addition of the
quote,
backup
with the
camera.
addition of the item.
Okay.
Make that motion.
Okay, we have a motion. Do we have a second?
Second.
A motion and a second. Any other concerns or comments, questions? Okay, if not, we'll do a roll call vote. Mr. Vaught? Aye.
Aye.
So approved.
I also listed on there just some other ones that we are continuing to work on and getting quotes. I did hand out to you all 4 additional items, if you will allow that to be added. Mr. Vaught, Mr. Smith, did you all get that by email?
I did.
Okay.
Was that the library?
There's 4 attachments.
Yep, I'm sorry, yes.
Okay. I'll start with buildings and grounds first. Buildings and grounds, $17,529. This is access controls. We've already started that project on most of the buildings. These are additional items and additional doors that need to be addressed. I believe this addresses the concern that the Commonwealth's attorney also recently raised about his door being left open or not been locked, and that will take care of that issue as well. So recommend approval of the access control system for buildings and grounds.
I'll make that motion.
Okay, we have a motion. Do we have a second?
Second.
Second.
Okay, we have a motion and a second. Any questions or comments? If not, we'll do a roll call vote. Mr. Vaught? Aye.
Aye.
Okay, so approved.
Next is a request from the Wythe County Circuit Court, Mr. Musser. I started to have Mr. Musser show up just to give him a hard time.
You should have.
Yeah.
The intended use of funds says digital imagining. And I want to give him a hard time and ask him what all he was imagining. But this is actually digital imaging. This is, they've got the deed books, and they're scanning those deed books and put them all online. And I can say from personal experience, and it's gone a whole lot further back since the time I was doing some of this research, being able to pull them up online saves you a trip down there. It saves people coming into the courthouse as it is. And Mr. Farthing would probably agree it is much more beneficial to sit at your office and pull them up. So the more that we can get digital image and available online, the better we are. I recommend the approval of the $25,800 for digital imaging, and that everyone give Mr. Musser a hard time about imagining.
So moved.
Okay.
Imagine one of them.
Well, we have a motion. Do we have a second? I imagine someone can make a second.
Second.
Okay, we have a motion. We have a second. Any questions or comments? I will say I appreciate them doing this. It's definitely time to bring that up to the electronic means, but okay. We'll do a roll call vote. Mr. Vaught? Aye.
Aye.
Okay, so approved.
The next item is for buildings and grounds. This is for the treasurer's office. This is for the divider and the separator. Recommend approval of the 610277.
I'll make that motion.
Okay, we have a
Second.
motion second. Any questions or comments? If not, we'll do a roll call vote. Mr. Vaught? Aye.
Aye.
So approved. And the last one?
Last one is from the Wythe Grayson Regional Library for list of items, high-touch items, hands-free items, things like that. Mr. Bowers has received that. He is reviewing that as well for any assistance. I would recommend, unless there's any questions or concerns you all have, approval of this up to this amount. We've got a little bit more work to do with them to see if this includes installation, or we may have to come back and talk about some outside contractors, because our staff is pretty covered up trying to do our projects for the COVID response. But would recommend approval of this amount for the library.
I'll make that motion.
Second.
Okay, we have a motion and a second. Any questions or comments?
Madam Chair, looking through the list of some of the stuff we have, I would ask that we use local businesses when at all possible. I know they've got a touchless faucet through Home Depot, and I looked it up with Lowe's, and they have it at the same price. So I would rather keep the business in Wythe County if we can.
Okay, I agree.
I agree with that wholeheartedly.
Okay. Was there any more questions or comments? Okay, if not, we'll do a roll call vote. Mr. Vaught? Aye.
Aye.
Okay, so approved.
That's all on the CARES Act review. Thank you.
Okay, thank you. We'll move on down to new business. The first item on new business is the consent calendar. Do I have a motion to approve the consent calendar?
So moved.
Okay, have a motion. Do we have a second?
Second.
Okay, we have a motion and a second. Any questions or comments regarding this? Okay, if not, we'll do a roll call vote. Mr. Vaught? Aye.
Yep.
Aye.
Okay, so approved. Next item under new business is the VACO voting credentials for 2020 annual business meeting. Mr. Bear, would you like to summarize this?
Yeah, typically every year we nominate an individual and a backup individual to cast votes for the county at the annual meeting, which typically takes place at the VACO conference. The VACO conference will be online, and the annual meeting will be I believe they said a WebEx type meeting. Typically, historically, it's been our chairman and then our vice chairman if they are planning on attending those meetings. So we just need to have a motion and a second for a delegate and an alternate delegate.
I'll make a motion for,
Mr. Baird,
Yes.
Madam Chairman, I wouldn't, since it's virtual, I wasn't planning on attending. My suggestion was going to be Mr. Bear attends. I think the most important session is the one about the state budget. I don't know if anybody else was planning on attending, but we definitely need someone there for that. But I'm not sure it's going to be worth the money they're charging for virtual meetings this year.
Okay. Did anyone else plan to attend that virtual meeting? No. Mr. Bear, do you have any comments on that?
No, you are allowed to appoint a non-elected county official as such, and so that would be fine. I do plan on attending at least the annual meeting part of it, so that's not a problem.
Okay.
Since I don't get to do this, I'd like to nominate Mr. Bear.
I second that.
Okay. Well, we have a nomination and a second. Any comments, questions? Okay, if not, we'll do a roll call vote. Mr. Vaught? Aye.
Aye.
So approved. Mr. Vaught voted twice, so I think he definitely did not want to attend that.
I was thinking them two's got good practice at this virtual stuff, so.
Yeah. Okay. The next item under new business is, let's see, the FY 2021 expenditure budget Second quarter appropriations. Okay, let's see here. Mr. Bear, would you like to summarize? this
Basically,
one?
just need you all to appropriate the second quarter appropriations so we can pay our bills next month.
So moved.
Okay, we have a motion. Do we have a second?
Second.
Okay, we have a motion and a second. Any questions or any line item budget that any board member would like to discuss further? Okay, if not, we'll do a roll call vote. Mr. Vaught?
Aye.
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 Okay, so approved. The next item on the agenda is staff reports. Let's see. Mr. Crawford, let's see, we've got the COVID-19 update. Is that you, Mr. Crawford?
So, thanks to Dr. Shelton for being here. I won't add a whole lot on to what she said. That was a lot of information. I do want to point out the cases per month that I gave you. We are, if things go as we've been going for the last little bit, it looks like we'll be around the same number of cases we've been for the last 3 months. We had 56 in July, 67 last month. We're at 50 as of today this month, so we'll be moving, we could move closer to those two numbers by next week. Other than that, we are still buying some supplies in. I hope to have a good amount more in before next week, as well as our health equity stuff distributed by that point too. And I'm working with some of our local groups to do that. This being my last board meeting, I do want to say thank you all for all the opportunities that you've given me. And I want to just, it's been a real joy and a real treasure to be able to serve the county for the past 2 years, and I do appreciate it very much. So thank you all very much. If you have any questions.
I don't have any questions, but I have a comment. I know you will be missed. I know in particular Speedwell Fire Department they were talking the other night, and they were very happy with you, and they hate to see you go.
Thank you.
Absolutely. You will be missed. Thank you, and best wishes to you at your new job and your family, and you better come back to visit us.
I'm sure I'll be around.
Sit through these meetings.
Just come through and spend money.
Yeah.
That's all we need.
Yeah, thank you very much.
Thank you, Mr. Crawford.
And I will just echo, of course, I see Curtis every day, but I've enjoyed working with Curtis. He has been an asset to us, and we will be working hard to replace him, but wish him well. And with him being next door, in addition to the gracious offer he made of staying here as long as he did helping us out, he said he'd still be available to help us out on anything we need be as we go forward. So we thank you.
Yes, thank you.
Thank you, sir.
Okay. Let's see, next we have the county administrator report.
Yes, Madam Chairman, before I get started, I had asked staff to be here just in case there were any questions on any of the CARES Act requests, and I will just check if you all don't have any other additions for questions for staff. I'll let Mr. Kinser and Mr. Bowers and Mr. Crisp leave if they would like. I still need Ms. Lane to stay, but she's not here right now, but she hopefully will be coming back in, unless you all need anything from any of them.
No, I don't believe so.
Thank you all.
Water rate, did we get the water rate report back yet?
We will have that information at the next water committee meeting. Yeah.
Okay. Thank you all. Enjoy
But
your evening.
we will mention, while Mr. Crisp is here, Thursday night at 6 o'clock at Sheffey Elementary School, we will be doing a meeting for the Olive Branch Dunford Road area residents to talk about the water, and if they want to connect to the water, have any questions about the water, about our project and future project out there. We are promoting that on all of our social media and websites and everything, and sent letters out, so we're trying to get as many people to show up to Sheffey School on that.
Okay, great, thank you.
All right, under County Administrator's report, first item, Barron Springs Fire Department request. Request you all do a budget amendment for $4,000 for the matching grant funds for the generator. You all approved this back last May, but we did not carry the funds over to the new fiscal year. They have completed that project and would need their $4,000. Request that you all amend the $4,000. And Part B is if you were doing the same. Now, just go ahead and do this first.
Okay. Do we have a motion to amend the $4,000 for the matching grant fund for the generator?
So
For
moved.
Barron Springs? Okay, we have a motion. Do we have a second?
Second.
A motion and a second. Any questions or comments? If not, we'll do a roll call vote. Mr. Vaught? Aye.
Aye.
Okay, so approved.
And request permission to go ahead and authorize and issue that check tomorrow, or as soon as possible.
Okay.
So moved.
Okay, we have a motion. Do we have a second?
Second.
Okay, motion and a second. Any questions or comments? I'm starting to sound like a broken record up here. Okay, we'll do a roll call vote. Mr. Vaught? Aye.
Yeah.
Aye.
Okay, so approved.
Next is a DCJS grant for supplemental funding for the Sheriff's Office. Recommend approval of that amount in $23,325, and to amend and appropriate the same.
Okay.
Make that motion.
Okay, we've got a motion. Do we have a second?
Second.
Okay, we have a motion and a second. Any questions or comments? If not, we'll do a roll call vote. Mr. Vaught?
I'll abstain.
Abstain.
Aye.
Okay, so approved.
Next is request approval for 3 grants for the Sheriff's Office, selective enforcement, alcohol, speed, and occupant protection, and request amend and appropriate, request approval of the grants and to amend and appropriate the amounts.
So moved.
Okay, we have a motion. Do we have a second?
Second.
We have a motion and a second. Any questions or comments?
This is for what now?
This is, the Sheriff's Office typically is able to secure these grants, and these funds are for their selective enforcement and there's the various things on there, the alcohol, occupant protection, and speed. We amend and appropriate this into the overtime budget, and this provides overtime pay for the deputies to be out enforcing these items.
And we get grant money back?
We get the grant money in, yes, and it pays for the overtime.
Any other questions, comments? If not, we'll do a roll call vote. Mr. Vaught? I'm sorry, Mr. Vaught, I couldn't hear you.
He abstained.
Okay, abstain. Okay, abstain.
Aye.
Okay, so approved.
The next request, transfers requested by the sheriff of $640.66 from the electronic summons funds to the PAF, and to amend and appropriate the same to vehicle supplies.
So moved.
Okay, we have a motion. Do we have a second? A motion and a second. Any questions or comments? Okay, we'll do a roll call vote. Mr. Vaught?
Abstain.
Abstain.
Yeah.
Aye.
Okay, approved.
Next is request approval for Spillman, Thomas, and Battle for legal services for our refinancing. You all may remember you previously had approved an agreement that if we figured out if we were going with the fixed rate or if we were going with the VRA, not fixed rate, but the bank rate or the VRA rate. So recommend approval of this agreement with a not to exceed $40,000 with Spillman, Thomas, and Battle.
So moved.
Okay, we have a motion. Do we have a second?
Hey.
Okay, we have a motion and a second. Any questions or comments? Okay, we'll do a roll call vote. Mr. Vaught? Aye.
Aye.
Okay, that's approved.
Next is for our performance of grants. You all remember the Vitality Farms and Muster Lumber that we have recently approved. Well, Vitality Farms, we approved a performance agreement last fiscal year. We have just approved a performance agreement for Muster Lumber. Would request that you all authorize transfer of $100,000 from the Board of Supervisors Reserves Industrial Development to the general fund and amend and appropriate the same to the Wythe County JIDA for the incentive payments for Vitality Farms and Muster Lumber.
So moved.
Okay, we have a motion. Do we have a second?
Second.
We have a motion and a second. Any questions or comments? Okay, we'll do a roll call vote. Mr. Vaught? Aye.
Aye.
Okay, so approved.
The next item, you have the job descriptions for the Assistant County Administrator and for the Emergency Management Coordinator. Would request your all's approvals of these job descriptions. The only revision has been under the special requirements. At the bottom, the position requires residency within Wythe County, within 12 months of employment in the position. So, like I said, recommend approval of the 2 job descriptions.
So moved.
Second.
Okay, we have a motion and a second. Any questions or comments? If not, we'll do a roll call vote. Mr. Vaught? Aye.
Aye.
Okay, that is approved.
The last item I had on the agenda was just informational items. We had did a lease financing purchase a few years ago for some electrical equipment, and we just received notification that that note has been satisfied with Carter Bank and Trust. There is one additional item, and Ms. Lang sat there quietly. And let this pass through during the CARES Act discussion. And I'll ask her to come up. This is for CARES Act review. And Mr. Vaught and Mr. Smith, I emailed you all a copy of that right at the beginning of the meeting. I don't know if you've had an opportunity to see it or not. But earlier this year, Ms. Lang discussed with us the potential of being able to set up a dispatch center for off-site dispatching should coronavirus hit. And obviously they are working in close quarters down there in their office. General consensus was that was a very good idea. Look at moving forward with it. As Ms. Lang got more involved with it and was getting more of the detailed quotes, the price jumped higher than what we desired. And so the committee looked at this, but we put it on hold until we could get some more information to look at this. What she has before you now, I will let her explain, but this has come down in cost substantially from what we were looking at before. Ms. Lang, I'll let you get some information.
Thank you, Mr. Bear. The last 2 quotes that I presented to the committee, one was a 1-year quote with service, and then one was a 5-year quote with service. This was from Two-Way. This was to cover the programming for the, excuse me, I was choking earlier, I apologize.
You're fine.
It was to cover the programming that goes on the console. Right now, our programming doesn't allow us to do IP or to do remote access. So we would need an updated program. This covers that. It also covered the 4 computers that we would need to go off-site. Once we delved into it more, we found out that we were going to need gateways for each controller radio that we have. We have 15 channels, one with our basic pathway, if you will, to the radio system, and then 15 channels on our backup. So if we lost power during any of this,
we wouldn't have access, so we had to get that access as well, which was another 15 gateways. So the two quotes that I presented actually raised from the original cost up to the 261 or 261,000 and some change. That included the warranty work, that included the service agreement. The 5-year quote for 5 years worth of service agreements went up to 385,000. We have since reworked that. We pulled the service agreement for 5 years, we pulled it for 1 year. On the radios, on the controller radios, that way we need the gateways. So we would have no coverage. If anything went wrong, we would have to call and hopefully get somebody out there as soon as we could, which is how we operate now. We don't operate with a service agreement with anybody. Since we pulled that, it's going to save us about $33,700 a year, or about $2,800 a month off of that quote. Our total price also, on the quote, we also subtracted 2 positions or 2 laptops with the programming, with the gateways. That dropped our price as well. So now the quote is back down to about $216. It's actually $216,143, and you all have a copy of that quote. But again, that's with no service contract on the programming, on the console. It's no service contract for the 30 control radios or the gateways to those radios, and no service contract on the laptops. So if they break, we'll just have to call them out by the hourly rate, which is about $80 an hour. But that's a lot cheaper than what they were requesting a month, which saves a lot of the money. So that's why I'm re-asking for the funds at the new quote price of the $216,000.
Okay.
If anybody has any questions.
Yes, Ms. This is Jamie Smith. Is it normal for us just to get one quote from one supplier versus getting multiple quotes?
I'm sorry, I didn't
Can
understand.
you repeat that, Jamie?
Yes, is it custom to just get one quote from one supplier on two-way versus entertaining quotes from other groups in the area?
Two-way actually has the Zetron. Procom doesn't carry Zetron. I can get it from them, but it's going to be at a higher price. Two-way actually, the program itself is actually lower from two-way because they're direct Motorola. It's a Motorola product, and it's actually less than the state contract.
Jamie, this is for discussion purposes. We'll have to get additional quotes to actually move the project forward unless we do it under emergency because of the declaration. But she can try to get it through Procom, but it's probably going to be higher. This is just a quote for you all to review if we want to move forward with it.
Mr. Barrett, the quote that they originally gave us was broken into much more detail than what we're looking at tonight. Part of the problem I had with the original quote was they wanted $30,000 for training. Is there a reason this quote's not broken down like the last one we had?
No, there's not. And if you would like, we can put this back to committee to review and look at. And if the board's okay with the committee reviewing the full details of the quote, I don't have the breakdown in front of me. I don't know if that has come out, the training.
I can say that the training is exactly the same as it was in the previous quote that you had. It covers 3 days training for 15 people. It also covers live cutover, and it also covers administrative training. So they'll have somebody come out, Zetron or Motorola will have somebody come out on site and train everybody to use the new system, the laptops, the gateways, and then be there on site when we cut over. And then administrative training.
I guess that leads me back into, I don't mean to be suspicious, but to get a quote that's not detailed less than, I guess, 2 hours before the meeting
when the part that I had a problem with was training, I would ask this be sent back to the committee and we get a detailed quote.
Not a problem. The main thing was just trying to see, since the price had come down, if the concept was agreeable to everyone to do it, and obviously we'll have to get the actual price to it, and those things can be looked at. But we'll refer it to committee for them to look at.
Okay.
May
Sounds
I make
great.
a comment and
Yeah.
a concern question?
Absolutely.
I get a lot of feedback from law enforcement, rescue, and fire about dispatch-related issues. So I've got some concerns. If we struggle this much when they're actually in an office environment to dispatch properly, what's going to happen when they work from home?
They're not working from home.
That's not working from home?
No, this wouldn't be working from home.
Okay.
This is working in the next room.
Okay.
Or in another room in the building, or potentially here, or out of the truck in the parking lot that the state police provides as a command unit.
Okay, so
This is not working from home.
Okay. Okay. I misunderstood. I apologize. I thought it was actually work where it would set them up where they could work remotely,
No,
like
there's-
from home.
We have one person that lives here in town
Mhm.
remotely. She could possibly work from home, but we would still have to, she has to be pretty close.
Perfect.
But this is not for them to work from home.
Okay.
Okay. Any other questions for Ms. Lane? Okay. Thank you so much.
Thank you.
Thank you.
We'll send this to committee to review further. Okay. Mr. Barrett, do you have any?
That's all for county administrator report. Thank you.
Okay, thank you. We'll move on to the county attorney, Mr. Farthing.
I do not have anything to report at this time, unless you guys have any questions.
Okay. You have any questions for Mr. Farthing? No? If not, we'll move on. Thank you. We'll move to Board of Supervisors time. We'll start with Mr. Vaught.
Madam Chair, I just want to say thank you for chairing the meeting at the last minute. I'm sorry to spring that on you. And I would like to say, and I'm sure Mr. Smith will echo my comments, thank you to Mr. Catron, Ms. Kegley, and Mr. Farley for getting this all set up this afternoon. They jumped in there and got it knocked out. And besides that, I've discussed some issues with Mr. Barrett, but that's all I have.
Okay, thank you, Mr. Vaught. I appreciate that, and I hope you feel better. Okay, Mr. Smith?
Yeah, first of all, I'd like to echo what Mr. Bard said about the staff getting this set up on short notice for us to be part of the meeting. I have 3 things I've already talked to Mr. Byer about through email, so I'm good.
Okay, thank you, Mr. Smith. Mr. Cook? Okay, I have nothing at this time either. Mr. McRoberts?
Mowing the grass, beat up.
Mr. Smith has shared your same concerns. Mr. Fowler has been emailing us both with information about that. Let's see if I can pull up the latest, but they are aware of it. A couple things have slowed them down over the last couple days. The rain, and then he referenced when I was talking to him today, the fog this morning slowed them down. But if all goes well with the weather, let's see, let me get the dates he's got on it, Mr. McRoberts. They have started mowing at the Grayson County line on Route 21 and mowed to the Wytheville town limits. They are continuing to mow the primary routes to include Peppers Ferry Road and the frontage roads, and will continue across Wythe County towards Pulaski County line, as I mentioned in the previous email. And it's my understanding that that is to be done this week.
Okay, the sign on Piney Mountain Road.
Did not have information on the sign on Piney Mountain Road yet. but we'll continue to work on GPS routing on it, or no GPS routing on it.
Thank you, sir.
Okay, Mr. Horning,
I don't have anything this time.
okay, Mr. Terry.
I have two things, ma'am. First, I don't know if this could fall under CARES Act money or what, but we need to look at making some investments in our sheriff's office. And what I mean by that is like riot protective gear. If you look, I think we've had 9 shootings in the past 2 years. We've had 4 deputies hit by gunfire in the past 2 years. And speaking with a couple, with a major client, he advised that our numbers for murder per capita is one of the highest numbers in the state based on our population. And to think that what you're seeing in surrounding areas with the violence and the riots is not coming to Wytheville and Wythe County would be a grave mistake. And I would much rather find a way to start investing in some of that equipment now versus waiting and needing it and not having it. So I don't know what that looks like, but I think that's something we need to start having some serious discussions on and try to move forward and make that happen. The other thing I have is regarding the library. I'm our representative for Wythe County on the Board of Trustees for the library. I have some concerns with the financials of that facility. I spoke with Mr. Bayer, and I think we're going to see if we can work out a meeting where myself and potentially Mr. Vault can sit down with 2 of their members and have a heart-to-heart discussion. I think that's the best way forward, but there are some issues there that needs to be addressed.
Okay.
And that is all I have at this time.
Okay, thank you, Mr. Terry.
Yes, ma'am, thank you.
Okay. Mr. Baer, do we have anything else under new business?
Not that I am aware of right now.
Okay. Entertain a motion to go into closed session under Code of Virginia, Section 2.2-3711.A.1, discussion of personnel matters. Okay, we have a motion. Do we have a second?
Second.
Okay, we'll do a roll call vote. Mr. Vault?
Aye.
Aye.
Aye. Aye.
Okay, we are now in closed session.
Make a motion to come out of closed session.
Second.
Okay, we have a motion and a second to come out of closed session. All those in favor signify by saying aye.
Aye.
Any opposed? Okay, Mr. McRoberts, one more time, please read the certification.
Resolution, certification of closed meeting, whereas the Wythe County Board of Supervisors has convened a closed meeting on this date pursuant to an affirmative recorded vote and in accordance with the provisions of Virginia Freedom of Information Act, and whereas Section 2.23712 of the Code of Virginia requires certification by the Wythe County Board of Supervisors that such a meeting was conducted in conformity with Virginia law. Now therefore be it resolved that the Wythe County Board of Supervisors hereby certifies that, excuse me, to the best of each member's knowledge, one, only public business matters lawfully exempted from open meeting requirements by Virginia law were discussed in the closed meeting to which this certification resolution applies, and 2, only such public business matters as were identified in the motion convening the closed meeting were heard, discussed, or considered by the Wythe County Board of Supervisors, and I make a motion that we accept this resolution.
Okay, we've got a motion to ratify the certification. Do we have a second?
Second.
Okay, we'll do a roll call vote. Mr. Vault?
Aye.
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 Yeah?
Aye. Aye.
Okay.
Last item of business, Madam Chair, is I emailed to you all earlier today as David and his staff were working on closing out our agreements. They have a performance agreement with the state APHID and the county and Vitality Farms LLC. but they did not have an agreement for the With Opportunity Fund, which was the $25,000 that we had previously agreed to provide them as incentive. What you have, what I emailed you and what you have in front of you is just the performance agreement for that $25,000, and it's like all our performance agreements. Part of it is based on capital investment, part of it is based on number of jobs. And so before David can issue the money to them, would request that you all approve this performance agreement.
Okay?
I'll make that
Do
motion.
we, okay, we have a motion and a second. Any questions or comments? Okay, if not, we'll do a roll call vote. Mr. Vaught?
Aye.
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 Okay, so approved. Mr. Bear, do we have anything else?
That is all.
Okay. Madam Clerk? You're good? Okay, anyone have anything else? Mr. Vaught, I hope you feel better. Mr. Cook, best of luck to you for, with your surgery. Let us know if you need anything. And if,
Just going to adjourn.
okay, if there's nothing else to come before the board, we are adjourned.